Welcome back to my channel. I miss you guys so freaking much. It's actually a little ridiculous. I'm always thinking about you guys, and I like to pop in, of course, every now and again. And so today I am filming a video that has a little bit of a sensitive topic, just where my life is concerned. I want to bring awareness to this. I'm going to try to deliver this content without getting too emotional. I want to just give you guys the facts. So I want to talk a little bit about type 2 diabetes and my mom, of course, because she is type 2 diabetic, and what has happened in the last 2 months. It was really scary, and the situation is multi-layered, like a lot of things in life, of course. And so I just want to make you aware, because if you know somebody that is type 2 diabetic and they're on this particular medication, you might want to check in on them and, you know, see if they're okay or if they're feeling any kind of way while on the medication, and to stop use if they are. So if you are unaware of what diabetes is, which you're probably not, let's get into it. Diabetes is a chronic, long-lasting health condition that affects how your body turns food into energy. Most of the food you eat is broken down into sugar, also called glucose, and released into your bloodstream. When your blood sugar goes up, it signals your pancreas to release insulin. So people that have diabetes struggle to produce insulin. So there's a difference, obviously, between type 1 diabetes and type 2 diabetes. My mom has type 2 diabetes. That's the really, well, that's the one that you get if you don't eat the best, and my mom's had it for years. My grandmother had it as well, and it's something that you have to be really careful with. Type 1 diabetes, basically your pancreas makes little to no insulin. So without insulin, your blood sugar cannot get into your cells, and then it builds up in your bloodstream. Type 1 diabetes is usually diagnosed in children and teens, but it can also be diagnosed in adulthood as well, and it can develop at any age. Type 1 diabetes is basically like an autoimmune reaction. So the body is attacking itself by mistake. And so that's why you see it more in children and teens. I know Shooter's cousin is type 1 diabetic. When the body's attacking itself, it's destroying the cells in the pancreas that are making the insulin. And so in type 1 diabetes, diet and lifestyle changes are not contributing factors, whereas type 2 diabetes, of course it is. If you eat a lot of sugary foods, if you eat a lot of carbohydrates, you are I wouldn't say you're prone or susceptible to it, but it is obviously a possibility that you can develop type 2 diabetes if that's all you're eating all the time. So type 2 diabetes is an impairment in the way the body regulates and uses sugar as fuel. This long-term chronic condition results in too much sugar circulating in the bloodstream. Eventually, high blood sugar levels can lead to disorders of the circulatory, nervous, and immune systems. And I've seen this with my mother. I don't remember what year my mom was diagnosed with diabetes, but she didn't even want to tell us at first, but she realized obviously she can't go through life not telling us that she has diabetes, so she ended up telling us. But it was when I was, I'm gonna say, in high school or just after high school. I can't remember exactly when she was diagnosed. Now, type 2 diabetes is much more common than type 1 diabetes, and especially in Black women and Black men, type 2 diabetes is a very prominent thing in our community, and so it's something that you have to watch for, and it's especially why we have to eat better and do better. As you guys know, I am prone to type 2 diabetes, obviously, because I'm not even going to say it's genetic, but the food habits are genetic. So the sweet loving, the sweet tooth, stuff like that is what is genetic, and those things just ultimately lead to type 2 diabetes. That's why I had to start my fasting journey and stick to it, because I do not want to continue that generational curse. I'm sweating, hold on. And I already see with my kids, they love sugar. Obviously they're children, but they love sugar a little bit too much, and we definitely have to nip that in the bud early on, because we do not want to complicate things. According to my research, hey Magic School Bus, in type 2 diabetes, there are primarily two interrelated problems at work. Your pancreas does not produce enough insulin, and cells respond poorly to insulin and take in less sugar. There is no cure for type 2 diabetes, but losing weight, eating well, and exercising can help you manage the disease. If diet and exercise aren't enough to manage your blood sugar, you may also need diabetes medications or insulin therapy. So with my mom, she recently lost a whole lot of weight. I'm going to say over 30 pounds my mom lost because she started doing somewhat of a keto diet. If you are diabetic, technically you're not supposed to do keto, so she wouldn't do full keto. She does like a dirty keto, or she does keto with carbs so that she has a steady blood sugar level. She was originally doing the prick in her finger, but now she has a Freestyle Libre, so I'll talk about that after. The reason that I wanted to do this video is because before she got on insulin, she was taking a medication that is in the market to this day, and it nearly killed her, and it was really, really scary. So like I said, my mom lost a lot of weight, and so technically losing that weight should have aided in her diabetes, type 2 diabetes journey, but there was some issues outside of that happened that caused stress and messed her whole entire system up. So she lost the weight, she was doing fine, and then long story short, one of my siblings came to Ottawa and released a poop storm of events that caused a lot of stress on myself and my mother. No, it's not to do with Malik. One day my mom had said to me, we were going on a walk, and she pulled me into her and she said to me, if anything happens to me, search my room. So she was giving me instructions on if she were to kick the bucket. And I could not handle that. Obviously, my mom is my freaking rock. Okay, she's my world. And I was really just taken aback by it, and I really didn't know how to process it. But from that day onward, I was watching her kind of deteriorate. And because she had lost so much weight, it didn't really make sense. The weight loss should have helped, but because of the stress from my sibling, it impacted the diabetes, and it caused like the utmost amount of chaos internally within my mom, to the point where she thought she was, like I said, gonna kick the bucket. She was weak. She was couldn't get out of bed. She was complaining about pain in her body and just aching, and she couldn't help me with my kids. I actually had to call her sister here to help take care of her because I can't take care of my mom and my 3 kids at the same time. So I had to literally call in reinforcements. That's how bad it was. It got really, really bad, and we didn't know what was wrong with her at first. But once I had called her sister, who was also type 2 diabetic, she was like, it sounds like, when I was describing the issue, she said, it sounds like it's her blood sugar. The thing is, my mom has felt like this before, only it was not stress related. My mom before was on a medication called Metformin. And once she was feeling like something was wrong with her, she stopped taking it. But she stopped taking it about 6 or 7 months ago. And she didn't tell anybody she stopped taking it. But when she stopped taking it, she felt better because she was experiencing so much pain and problems internally, like I said, without the added stress. So for 6 months, she's off the medication. Her blood sugar has been fine. But then my sister comes here. She moves to Ottawa, causes a whole catastrophe. And then that stress brought on elevated glucose levels in my mom. When I say elevated, I mean dangerously high. So I searched to see if stress is a contributing factor to glucose levels or diabetic issues, and what I found was stress is a potential contributor to chronic hyperglycemia and diabetes. Stress has long been shown to have major effects on metabolic activity. Energy mobilization is a primary result of the fight or flight response. Stress stimulates the release of various hormones, which can result in elevated blood glucose levels. And that's exactly what was happening. Only the stress that my sister brought onto my mother elevated her glucose levels. So then she had to start taking the medication again because my aunt was like, it's her sugar, she needs to take her medicine. So we put her back on the metformin, and then a whole other slew of issues starts happening again that were happening 6 months ago. And so obviously we know it's the medication and she can't be on that medication. But that's not the first medication that she's been on. My thing is, my mom is not the only person that's experienced these issues with this medication. It's like if you're watching TV and a commercial comes on and it's advertising some kind of medication for your diabetes or for your HIV and AIDS or for whatever kind of ailment you have. In Canada, we actually cannot go to the doctor and say, hey, I saw this on the TV. Can you prescribe this to me? That's not how it works here. Those commercials that we see are on American networks. So in America, the pharmaceutical company can advertise directly to you. But here in Canada, that's not how it is. But we still see those commercials. So basically, when you're watching those commercials, when you get to the end of the commercial, there is like a fine print, and you hear a really fast voice going saying, if you are experiencing this may cause this, a slew of other issues that you did not have before. Stop taking this drug. That's basically what was happening with the metformin. There are over 50 different types of medication for type 2 diabetes on the market. If you have type 1 diabetes, I think you automatically get insulin. But there are over 50 different types of orally prescribed medications for type 2 diabetes. My mom has taken multiple. She was on one before that was also causing issues, and when she went to her doctor and she told her doctor, I'm experiencing this, and this, the doctor said, did you stop taking the medication? And she was like, no. He's like, stop taking it immediately. What? If you guys are prescribing me medications, shouldn't you tell me this before I start taking it? Shouldn't I know before? And that has never been the case. They tell her, you're going to be on this. Obviously, she's not expecting that it's going to cause complications outside of her diabetes or within her diabetes. If you're giving me a medication, I'm expecting it to work. It's like if I take Tylenol for my headache, I'm expecting the pain to go away, and it does, and it's effective. Obviously, long-term use with something like Tylenol, if you're taking it every day, it's going to cause an issue, but that's because you're taking it every day. Tylenol is not for everyday taking, or taking it every day, whereas a diabetic medication is. Metformin is the McDonald's of diabetes medication. The point is that something like metformin is supposed to fix a problem, not create new problems. And if it is, in fact, possible that it creates new problems, why is it being marketed and why is it being given to patients with diabetes? It literally almost killed my mom. I took one of the metformins and I put it in a glass of acid to see how it breaks down in the glass, and it did not break down. It turned into like this cocaine rock, like I don't even know how to describe it. It dissolved a little bit, but then it just stayed there. And I said, if that's what it's doing here, what is it doing in my mother's body? Like I said, she stopped taking the metformin 6 months ago, but then she had to go back on it before she got on insulin. And when she was on it, her body wouldn't even keep it down. It's like God was like, no, this is not what's going to happen because this is killing you. So she took the metformin and she would literally throw it up, or she would take it and she would see it in her poo. This is a little graphic. But this is what was happening. It would not dissolve in her body. And so my question is, like I said, what happens when instead of fixing an issue or helping to regulate an issue, a medication that is being prescribed is causing more issues. So the side effects of taking metformin: nausea, vomiting, stomach upset, diarrhea, weakness, or metallic taste in mouth may occur. If any of these effects persist or worsen, tell your doctor or pharmacist promptly. If stomach symptoms return later after taking the same dose for several days or weeks, tell your doctor right away. It's like, how do these things get approved? And then how are doctors giving, like, everything is attached to money and the pharmaceutical company and industry. The doctors do not care about the patients, period. I don't care what anybody says. They do not care about the patients. And it's obvious, because how do they prescribe my mom a medication and not tell her, watch out for these side effects? If these side effects happen, then stop taking the drug. They never ever tell her that. They just say, okay, I'm putting you on this. You need to take it this many times a day, blah, 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 blah. They do not express to her that there are side effects that are damaging to her body. And if she had known that those were side effects ahead of time, she would have been able to stop taking the medicine earlier. It's only because she was feeling so bad 6 months ago that she stopped taking it. And then she started feeling better. But then, like I said, stress came and aggravated her body to the point where she had to go back on it just to regulate her sugar. And we saw right away when she took the metformin that her sugar levels started to decrease, but it was causing the problems that she had before. So once she had expressed that to her doctor, then they finally put her just on insulin. So some of the other side effects my mom was experiencing 6 months ago and then recently in September: decreased appetite, fever and chills. She had been actually complaining about the fever and chills from before we even moved here. So over a year, over a year or so ago, she would complain about fever and chills. And so a lot of the side effects border on looking like COVID symptoms. And so she's calling telehealth, and they're telling her she doesn't have COVID or COVID symptoms. But then when you look this up, you see they were right. She didn't have COVID symptoms. She has the symptoms that are associated with the drug that they prescribed her for diabetes. So fever and chills, discomfort, lower back and side pain, muscle pain, and cramping, which she experienced a lot of. Like, this is what I'm saying. She literally could not get out of bed. She didn't experience painful or difficult urination, but she definitely experienced sleepiness. So I'm thinking my mom's depressed. Like, I went in her room. It was dark. She was not getting up. I'm like, I literally had to keep checking on her to make sure she was freaking breathing, because I really thought that, like, it was over. It was a wrap. Anxiety. Blurred vision. Oh my god, that's the other thing. So about a year ago, she had an eye appointment, and apparently she's a guinea pig. They squeezed this thing in her eye, and I don't know what it was. She doesn't know what it was, but when she was on the phone with the diabetes doctor the other day, they asked her, when you went to the optometrist, did they squeeze something in your eye? And she's like, yes. And she has been complaining about this eye for literally a year now, and saying that ever since she went to the optometrist the last time and they put that thing in her eye, it's like there's like a film over her eye and she cannot see properly out of it. She's been putting breast milk in there. She's been using Polysporin pink eye drops to help fix the problem, because they have used her as a freaking guinea pig. Like, the malpractice that's going on right now is absolutely insane. When the doctor asked her that about the optometrist, when the diabetes doctor asked her that about the optometrist, she just took a note and she didn't really elaborate. And I asked my mom, like, why did she ask you that? That's such a random question. And she said she doesn't know. Like, I wish I was in the room, because I would have been asking the doctor, why are you asking me that? But I think at the time that the doctor was asking her all the questions, it didn't really sink in that they may have done something that they weren't supposed to do to her. Chest discomfort, cold sweats, coma, confusion, cool or pale skin, depression, difficult or labored breathing, dizziness, fast, irregular pounding or racing heartbeat or pulse. Why are these the side effects of a diabetes medication? And if these are all the side effects of a diabetes medication, why was it approved? Why are they giving it to people? Feeling of warmth, headache, increased hunger, increased sweating, nausea, nervousness, nightmares, redness of the face, neck, arms, and occasionally upper chest, seizures, shakiness, slurred speech, tightness in the chest, unusual tiredness or weakness. These are considered less common, but I saw a lot of them with my mom. So I don't know that they are necessarily less common. The rare ones are behavior change similar to being drunk, difficulty with concentrating, drowsiness, lack or loss of strength, restless sleep, unusual sleepiness. I definitely saw my mom being restless. So my mom was like textbook symptoms for taking metformin. More common symptoms, which I also witnessed with her, were sour stomach, belching, bloated, excess air or gas in the stomach or intestines, full feeling, heartburn, indigestion. She had so much heartburn and indigestion, and I'm thinking it was because I was pregnant and she was having symptoms with me, because she did. But actually, she didn't. She was literally just on the diabetes medication, and it was causing these issues for her. Passing of gas, stomach ache, stomach upset or pain, vomiting, weight loss, less common abnormal stools, bad, unusual, or unpleasant aftertaste, change in taste, difficulty with moving, discoloration of the fingernails or toenails. This was a big one for my mom because I was literally doing her nails in my office and they were so brown. And I'm like, Mom, what the heck? And she's like, it's the metformin. And this was months ago. And recently I went to do her nails and they were all back to normal. And that's because she had stopped taking the medication. So I'm literally witnessing my mom's body deteriorating while she's on these drugs. And I'm sat here confused, like, well, they're not helping you if they're hurting you in other ways. Flu-like symptoms, joint pain, rash, sneezing, stuffy or runny nose, swollen joints. So you mean to tell me that all of these are the side effects and, okay, yeah, just take it because it's going to lower your blood sugar? No, put the people on insulin. I don't understand why insulin is not just the only thing given for diabetes. Unless the insulin causes a problem, then give them something else. But if insulin, I feel like insulin should be the answer for both type 1 and type 2 diabetes. So of course insulin is prioritized to people with type 1 diabetes, right? But if it's been proven that insulin has been more effective and causes less side effects than other orally taken medications for diabetes, why is it not offered first? And just like the orally taken tablets, there are many different brands of insulin on the market, because apparently we're in the bread aisle at the supermarket, but there's so many different ones that can be taken, again, because when we're talking about pharmaceuticals or the pharmaceutical industry, it is a money grab. So there can be 50 brands of insulin and there can be 50 brands of metformin, or 50 different companies creating metformin, and at the end of the day everybody's going to get paid, but at the expense of who? See, the metformin companies are cashing in while my mom is sitting here dying because there's so many side effects of their approved medication. Make it make sense. How is this okay? And you expect me to believe that the government cares about the people? No, this is all a money grab. Like, the change that I see in my mom from when she was on the metformin versus now where she's on the insulin only is night and freaking day. She's not complaining to me about her body pains. She's not complaining to me about her weakness or not being able to get out of bed. She's not feeling depressed. She's not reacting negatively to her medication, and she doesn't have to prick her finger anymore because she's on insulin. Now she's approved for the Freestyle Libre. So Freestyle Libre, basically I have to inject my mom with this monitor. Nick Jonas is on it. Hey, Nick. In the back of her arm, and she just has this little thing that she walks around with, and she can check it at any time. She just scans the back of her arm, and then she knows what her blood is at, and her blood has been so consistent, or her glucose levels have been so consistent ever since she's been on the insulin. Aside from the fact that she's also not having pains in her body. So if you know somebody that is on metformin or Janumet, which is the one that she was on, Janu something, let me Google it, yeah, Janumet, sitagliptin, Janumet, these medications that are on the market that the doctors are prescribing, because how the doctor office works in my eyes is like they are the middleman. So they're offered these medications to give to the patients, and every time a diabetic person brings their insurance to go collect their medication, everybody's getting paid. Okay, so my mom's bringing her insurance to go pick up her medication, and the drug companies are being paid every single time my mom has to fill her prescription. The pharmacists are being paid, the doctors are being paid, because the doctors also took the insurance and said, okay, I'm gonna put you on this. It's a big freaking pyramid scheme of medications when it should just be freaking insulin. Like, give the people with the diabetes the insulin, and let's see how that works for them. Obviously, everybody's body's going to react differently to Janumet or to metformin, but the gag is that there has been lawsuits about this medication. So my question is, if there has been lawsuits for this medication because people have been sick on it, why is it still on the market? And why did they give it to my mom? Why y'all tried to kill my mama? Please let me know. And I'm supposed to trust the doctors, and I'm supposed to trust the pharmacist, and I'm supposed to trust the pharmaceutical company? Is that what you're telling me? Y'all tried to kill my mom. Like, they real life tried to kill her. They tried to kill her because also when they prescribed her the insulin, they told her she needs to take the insulin and the metformin still. Why? Why? Are we trying to put her into low blood sugar now? Why does she need insulin and metformin? And then, without telling her, they stopped her metformin prescription. Obviously, she doesn't care because she wasn't going to take it anyway. But the fact of the matter is, they told her to take both and then stopped one. Make it make sense. Not to mention, when she first got her insulin, she took it. And we were watching to see how her body's reacting to it and her blood sugar levels and the Freestyle Libre reader. And she was fine. So she's like, if I'm taking this, the insulin, and I pop a metformin, my blood sugar is already reading at 5.5, 6, 7. It's really good. Why would I take a metformin as well? They is trying to kill her. Like, what? I really can't, I really couldn't make it make sense. I'm like, no, Mom, this doesn't make any sense. Are you sure that they said to take both? She said, yes, look at the paper. Look at the paper. Either people had other people write their tests at the school to become doctors and pharmacists, or we're still trying to find a way to get the pharmaceutical company paid. That has been causing more harm than good. I'm going to read y'all about the lawsuit in a second. Pancreatic cancer, which is actually how one of my great-grandmother passed away from pancreatic cancer. And I don't know if she was diabetic. She passed away from pancreatic cancer. And Janumet and metformin are linked to pancreatic cancer because they are not good medications for people to be taking. They have way too many side effects, and they should not be approved. They need to be removed from the market. And that's, I guess, why I'm making this video, because I would really like to know, and I would really like to have an answer as to why something like this is still on the market. In 2013, study in JAMA International Medicine found people who use sitagliptin had double the risk of acute pancreatitis. The FDA already flagged acute pancreatitis as a problem with Janumet early on. It required Merck to conduct additional studies to assess the risk. The FDA began investigating new reports of possible increased risk of pancreatitis and pancreatic cancer from Janumet and other drugs in its class in March 2013. The FDA had become aware of new findings that examined a smaller number of pancreatic tissue specimens taken from patients after they died from unspecified causes. No. It was not unspecified, child. It was y'all. You guys are murderers. The findings suggested that an increased risk of pancreatitis and precancerous cellular changes in patients taking the drugs, according to the FDA. But like I said, they are still selling it because my mother was on Janumet. Out of 7,332 people who took sitagliptin, 23 developed acute pancreatitis. Now, you might be thinking, well, out of 7,000 people, 23 is not a lot. It shouldn't be one. Like what? It should not be one person getting acute pancreatitis from taking a medication that's supposed to be helping with their diabetes. There shouldn't be one person. So don't tell me that 23 is not bad for 7,000 people, because it is. Especially because 2 of those patients died. 4 of the cases that happened in that situation were severe, and 2 of those patients died. Out of 7,339 people who took placebo medication, 12 developed acute pancreatitis. Obviously, the placebo wasn't a damn placebo. Because if it's a placebo, then it should be something like a Pez, a Tic Tac, a placebo. They think they're taking the drug. It should be a freaking Tums, you know what I mean? 12 of those people developed acute pancreatitis. Authors of the study found cancer occurred more in people who took the placebo versus those who took sitagliptin. The person that was conducting the study, Merck, cautions that pancreatitis is a serious side effect of Januvia and Janumet that can lead to death. Patients should tell their doctor immediately if they have severe pain in their stomach area that won't go away or extends to the back. There is an attachment to heart failure from taking sitagliptin. The thing about it is, when my mom picks up her medication from the pharmacist, it would just come in this white bottle with a sticker on it that's directly from that little pharmacy. It never came in a bottle that was from the Janumet company. It was literally like a white bottle that, I guess if they're getting a big vat of the pills, they scoop out what they need and put it in individual bottles. But it didn't come in like, you see if you have a Tylenol bottle, it says Tylenol, and then on the back, there's a label on it. There was no label on my mom's medication. So my mom didn't ever see the risk of heart failure or heart complications on the label because it didn't exist. There was no label on her medication. The manufacturer says doctors should consider the risk and benefits in patients at risk for heart failure. People with kidney problems are at greater risk of heart failure when taking Januvia and Janumet. Why are you guys selling faulty product? It's giving Harry Wormwood. Like, what is going on? You guys are selling lemons. I don't understand. Like, you guys are telling me you guys did studies. People died during the studies. You guys are telling me you guys did studies. People were hospitalized during the studies. But you guys still said, this is a great medicine. Let's put this medicine on the market. Let's give this to the people. Let's lower their blood sugar and kill them. Like, what? I'm perplexed. I really am. Like, I'm perplexed. Severe joint pain, skin problems, lactic acidosis. And another side effect was definitely weight gain because, like I said, once my mom came off of the drug and started doing the dirty keto, she lost so much weight. So the drug was not only causing those kind of problems, like chills and freaking joint pain, but it's also making her fat or not allowing her to lose weight. And there's literally forums. There's a website called askapatient.com, and people are discussing what issues they had on the medication. That means that these side effects are very common. So pull the drug off of the shelves. Pull it off of the shelves. Like, I would have been so... Girl, let me go read about the lawsuit. Judges consolidated lawsuits against the makers of type 2 diabetes drug Janumet, Byetta, and Victoza. Victoza is the other one that my mom was on that she told the doctor, and the doctor said, stop taking it right away. Like, that was the first one that she was on. In California federal court, nearly 1,000 plaintiffs claim the drugs cause pancreatic cancer and pancreatitis. So that little study that was talking about some damn 23 people out of 7,000, BS, because there's 1,000 people here complaining and suing that this drug caused issues, severe issues. The lawsuit landed in courts across the country and claimed the drug makers failed to warn about the risk. And apparently, they didn't learn their lesson because they're still not warning. And the doctor is not doing their due diligence and warning prior to prescribing. Even when I take my children to get vaccinated, they tell you, look for these symptoms over the next few weeks. They may feel a little ill. They may have a fever because they're getting their vaccinations. Like, that's what they tell you. So if the pediatrician can tell me, look out for this, the diabetes doctor should be telling my mom, look out for these symptoms, not just prescribing the medication and my mom thinking, oh, this is just gonna lower my blood sugar. Not lower my blood sugar and kill me, okay? Like, she did not sign up for that. The fact that death is one of the symptoms or side effects of taking a diabetes medication actually is like an oxymoron. So again, I pose the question, if insulin is not causing these same issues that these oral tablets are causing, why is insulin not the first thing offered? And my other question is, Victoza was causing an issue and has side effects similar to sitagliptin, Janumet, Metformin. If it has symptoms similar to that drug, because they're basically all the same damn drug repackaged with a different name, okay? It's Tylenol, it's Advil, it's Motrin, it's Midol. You know what I mean? Like, if that is the case, and it's just a rebranding thing, why are you giving me that when this one caused an issue? Give me the insulin. Let's see if the insulin works. And if the insulin don't work, well, baby, just let me get the shovel and let me dig the hole and let me just jump in. Because what's the point? Like, what's the point? Make it make sense. So if I was on Victoza, my mom, I'm speaking for my mom. If she was on Victoza damn near killed her, and you gonna give her Janumet, Metformin, how does that make sense when that is also killing people? And you as a doctor know that these drugs have had lawsuits. Or do you not know? Are you too busy to know? Like, they do not care. They do not care. And where does that leave the patient? So thank God now she's just on insulin. It's been working beautifully. She loves her Freestyle Libre, even though Nola's always trying to pick it off her arm. Everything's been going super smooth. The stress levels have dissipated. Okay, it is gone, girl. Okay, for the most part. She can get back to her normal everyday activities. She wakes up every day. She's in a good mood. She's strong again. Like, you know what I mean? Like, she's doing so well. And that's because she's on the insulin now. But it was super duper scary dealing with that. To the people that caused the stress, well, okay, see you never. And to the pharmaceutical companies that are producing these drugs, knowing full well that they are killing people, y'all are going to hell. Y'all are going to hell. And to the doctors that know that these drugs are causing an issue and you're still prescribing them, y'all are going to hell. Didn't you sign an oath? Did you not sign an oath? Let me look up the doctor oath, girl. What is the oath? I swear by Apollo physician and Asclepius and Hygeia, girl, and Panacea, girl. They had all the girls. They had all the girls with all the names. I don't know how to say those names. And all the gods and goddesses, making them my witnesses that I will fulfill according to my ability and judgment this oath and this covenant. Let's read the modern version, okay? I swear to fulfill, to the best of my ability and judgment, this covenant. I will respect the hard-won scientific gains of those physicians in whose steps I walk, and gladly share such knowledge as is mine with those who are to follow. I will apply for the benefit of the sick all measures which are required, avoiding those twin traps of overtreatment and therapeutic nihilism. What does nihilism mean? Let me Google that. Let me look it up. The rejection of all religious and moral principles in the belief that life is meaningless. Negativity, anarchy. I will remember that there is art to medicine, as well as science, and that warmth, sympathy, and understanding may outweigh the surgeon's knife or the chemist's drug. I will not be ashamed to say, I know not, nor will I fail to call in my colleagues when the skills of another are needed for a patient's recovery. I will respect the privacy of my patients, for their problems are not disclosed to me that the world may know. Most especially, I must tread with care in matters of life and death. Apparently not! Because this was a life and death matter. You've given out drugs that are killing people. And y'all is okay with it. And we're just supposed to trust you with everything else. Girl, bye. Based on my feelings, based on what I know about how the doctors and the pharmacists have handled the situation with my own mother, based on how I clearly see that they don't care as long as their pockets are lined, they can't say anything to me about anything, about any drug on the market, about anything on the market, because it's clear what the motive is behind it. And it has nothing to do with us being taken care of, with us and our health. They don't give a damn about that. Why would they care about that? What does it do for them? Absolutely nothing. They want people to stay sick. Please remember that. They want people to stay sick because their pockets continue to be lined. If my mom stays sick or gets sicker while she's on the Metformin and she has to keep taking the Metformin because her sugar is all over the place, their pockets continue to be lined. There is money in sickness. So don't be fooled, okay? Stay woke, y'all. If it is given me to save a life, all thanks. But it may also be within my power to take a life. Oh, so that's why we're here. This awesome responsibility must be faced with great humbleness and awareness of my own frailty. Above all, I must not play at God. I will remember that I do not treat a fever chart, a cancerous growth, but a sick human being whose illness may affect the person's family and economic stability. My responsibility includes the related problems if I am to care adequately for the sick. I will prevent disease whenever I can, for prevention is preferable to cure. I will remember that I remain a member of society with special obligations to all my fellow human beings, those sound of mind and body as well as the infirm. I will prevent disease whenever I can, for prevention is preferable to cure. You were supposed to be preventing diseases, so why are you, as a doctor, prescribing medication that is causing pancreatic cancer, pancreatitis, abdominal pain, muscle pain, joint pain, headaches, diarrhea, nausea, heartburn, indigestion? Girl, why my mama gotta be on Pepto-Bismol? Do you know how much Tums we went through between my pregnancy and her acid reflux from Janumet? Do you know how much Tums we went through? Girl, I was at Costco buying Tums like it was going out of style. I cannot make this up. The oath literally says you're supposed to prevent disease whenever you can, but y'all were causing it. Okay, doctor. If I do not violate this oath, may I enjoy life and art, respected while I live and remembered with affection thereafter. May I always act so as to preserve the finest traditions of my calling, and may I long experience the joy of healing those who seek my help. You didn't heal my mother. You caused problems. So you telling me you sat up there, took that oath, and then sat on the other side of that desk and started prescribing whatever drugs they laid onto you and said, give these to the patients. Give these drugs with all these side effects to the patients. After you done sat there and took that oath, no. Revoke the oath. Revoke the license, okay? Take the license away from all the doctors and all the pharmacists, because I'm over it. I'm over it. My mom whispered in my ear, if anything happens to me, search my room. Do you know what that did to me? Like, anyway, that was my September. And I'm just happy that everything is smooth sailing now. But I am calling for Janumet, Metformin, the pharmaceutical company. I am calling for all these people in power to remove these drugs that are harmful off the market. If you can sit there and list to me 10 different things that it may cause if I take this, it needs to be off the market, period. And of course, everybody's gonna say, well, everything has a side effect. Yeah, but if the side effect is leading to death, if the side effect is death, then it's unfit. It doesn't work. It's ineffective. Bring it back to the drawing board. Go back to the drawing board and create something else, okay? Like, these doctors are not interested in helping patients. None of them. They just say, here's this medication. Be on this. Die. Okay? That's all they do. They just advertise medication. They do not say, try this diet. It may help you. And then we'll go from there. They also don't tell her that the side effects are leading to freaking death with the pills that they prescribe. I get it that we have some responsibility as adults, as people, to research the drugs we're taking. But if we have been taught to trust the science and the doctors, if my doctor prescribes me something, I'm not gonna really think twice about it. You're a doctor. You took this oath. I know you took the oath, so I'm thinking you're here to help me. I'm not thinking you're here to harm me. And two, when people are getting up in age, like my mom is getting up in age, she can't process too many things, okay? She needs it to be real plain and simple for her. If they had told her that at the jump, she would have never have taken it. She would have said, no, what are my other options? But she was never really given that opportunity. Literally, poop had to hit the fan for her to get insulin. And we're going to give that one to the grace of God. We're not even going to give that to the scientists and the doctors and all that. We're giving that one to the grace of God. He had all these things fall into place so that she could get on insulin and insulin alone. Now we are way more diligent in researching stuff. Like even the insulin, we still have to research it to make sure to look out for certain things. But because she's been so healthy, we're all right now. It's really important to do the research yourself because these doctors and the they're not telling us the true tea. You got to go find out for yourself now, okay? They are underpaid and overworked, I guess, so they don't want to tell us the truth. And so it's really on us to do it for ourselves. But yeah, scary stuff the last few months, but everything is on the up and up, so whoo, thank you, Jesus. And yeah, that's pretty much it for this video. Let me know in the comment section below if you are dealing with or know anybody dealing with type 2 diabetes, and if they're on metformin and Janumet, or if you know anybody that experienced these side effects due to taking medication, whether it's for diabetes or something else. Don't be playing with the pharmaceutical company, y'all, because they are not making drugs to cure the sick. They're making drugs to line their pockets. If you get cured in the process, that's an added bonus for you. But if you die in the process, they still get paid. They still get paid. And then you're left with the baggage to go find out what drugs was your parent on, or what medication was your parent on that possibly killed them. Now you have to go sue. They're going to have your lawsuit sitting there because the lawsuits that I was telling you guys about, they're pending. Because they don't want to pay, and they're going to try to go through hoops and hoops and hoops to not pay when they are liable. You know, just be cautious, be aware, and that's what's going on, okay? So we calling them out. Literally shame on them. Shame on them. I love you all so much, and I will see you guys when I see you.